Hello and good Wednesday evening to you. I just wanted to do a recap of week one. Everyone has the assignments in that were assigned, so just thought I would go over a couple things. First of all, this first module is really an overview of computer systems and in general, and more specifically, how they relate or are utilized in healthcare. So what we're doing is we're taking some of that basic information and we're applying what we've learned into these discussions, position papers, and the quizzes as well. Now, keep in mind that the healthcare administration degree is a leadership degree. And part of being in that leadership position and getting you prepared to take on leadership positions is teaching you how to be persuasive, how to think critically, overcome obstacles, especially at the organization setting, where you may have an opinion or a thought of how things should be done. Now it's up to you to persuade people. You may be a key person to persuade people to think along your lines. And to do that, it's very imperative that you're able to see all the different sides of an issue. So, people are not going to tell you necessarily what they're looking to see from you. You may not be working with enough information, but if a leader comes up to you and says, I need to know more about electronic medical records or meaningful use or cybersecurity, they're really not going to give you any guidelines as to what that's going to look like. And they're certainly, especially with the discussions, are not going to expect you to cite text or example. So, if you have an example from something that you've read a few different articles, and you say, oh, this is a relevant thought, you don't necessarily need to cite that. Now, what you will need to do is that if somebody challenges you in the professional world, you will need to be able to back that up. But for these discussions, this is very much like you were sitting in class, raising your hand, and we were discussing each of these different topics. Moving on, I wanted to talk about the assignments as well. So first of all, thank you for doing the introduce yourself. I learned quite a bit about a lot of you, and it's been able to help me tailor some of my feedback to you and make it more relevant to your current situations or where you would like to be once you get this HCA undergraduate degree. But the quiz, we'll start about that. The quiz, the mean score on that was 93%, so we did very well. A lot of A's and B's. There were multiple opportunities to take this test, and almost everyone took it at least twice. So there's a couple that took it 3 times, but really take those opportunities. This is not a weed out class. I want you to know the information, and I want you to know the correct information. Couple of points on the High-Tech Act question about what office was created. It's the Office of the National Coordinator, the ONC. And the ONC is at the forefront of the administration's health IT effort, and it's a resource for the entire health system across the United States to support the adoption of health information technology and the promotion of a nationwide health information exchange to improve health care. It's actually within the Department of Health and Human Services, and it's the principal federal entity with coordination of charged with the coordination of nationwide efforts to implement and use the most advanced health information technology available. That's almost word for word off of the About section of the ONC site. So there's no reason to not know that. Just go to the website. There it is. The other tripping point, it seemed like, was the question about discussing your thoughts about how an IT department can benefit from having a professional with clinical experience as part of their department. Well, the primary benefit of having a clinician is having an advocate for the end user to help them develop and or implement the systems that these end users are going to be using. To give you an example, when I worked at Cerner, I was kind of the clinical liaison between our developers and our clients who were asking for something. So we would put together a requirements document and we would give it to our coders, and they would start putting the programs together. And we can talk about system development lifecycle and scrums and different development methods. But the idea was that we were looking for functionality for the end user, for the clinician in this specific circumstance. And there were times where I'd have a developer who would look at me and say, hey, you know, this thing, diagnosis and diagnostics, those words sound so similar. Can we just change diagnostics to X-ray? Well, no. Your end user, the clinician, is never going to confuse diagnosis with diagnostics. And diagnostics is much more than just X-rays. It's CT and ultrasounds and PFTs and a whole range of different diagnostic texts that are utilized by clinicians to aid them in either just deciding what to do with a patient or to decide what a patient has going on with them. So these developers don't have that clinical background. So having a clinician there enables them to be guided to actually develop and produce and deliver what the clinicians are expecting, and in a way that they're expecting. It doesn't make any sense for us to correlate, for example, heart rate with maybe trazodone. It doesn't really have any effect on on heart rate, but the IT department doesn't know that. But if we have some way of taking trazodone or Ambien, for example, and putting it with some of the clinical documentation to see that this person is restless in the middle of the night or trying to get out of bed and the bed alarm keeps going off, well, if they're prescribed Ambien, one of the side effects is the fact that it can cause sleepwalking. And we want to be able to catch that as soon as possible. Phenergan. We might have somebody who has sundowners who's been given Phenergan and they have auditory and visual hallucinations. Well, every time they get Phenergan, they have these auditory and visual hallucinations. With these clinical systems, we're able to correlate those things so that we can say, okay, well, when we don't give that to that person, they don't exhibit these schizophrenic type tendencies. Well, is it medication related? Obviously it is. Versus is there just, maybe they do have sundowners and it's Alzheimer's or some other organic brain disease. So having a clinician there really enables the IT staff to deliver what the clinicians need and what they expect, so that it really can help improve patient care. As far as discussion 1 goes, the majority of you received a 30 out of 30, unless you received something from me asking you to repost or to redo the assignment. Again, there's no real trick questions either on the quizzes or in the discussion. I really want to know your thoughts. And I also will assign participation points at times without you having responded to somebody. That does not mean you don't have to respond. I do have the ability to go back in and make sure that everybody has responded to at least 2 and meet the requirements of the college, but I may give those points without you responding. This discussion, this response to your classmates, gives you an opportunity to interact with other people and find out what they know. And maybe they will see a viewpoint or have an idea that is different from what you did, or something you didn't even consider. So because we don't have that classroom participation where we're all sitting together in a group, this is the best way we can get each other to interact. So it is very important that you interact with each other and you respond to each other's posts. More than responding, that you read each other's posts, because you guys have some excellent posts out there. If we were in a brick and mortar class, you would raise your hand, and if you would answer a question, I wouldn't expect you to cite. So as far as citations in the discussions, that's okay as long as you're quoting something or you're putting together some facts and figures. That would be appropriate to go ahead and cite that reference. However, I'm not really looking for citations as much as I'm looking for your thoughts and your viewpoints. In this particular discussion point, the you go first, I really am looking for you to consider the early adopter versus late adopter, the positive, negatives, choose a side, and be able to not only articulate all the sides of the issue, but then come up with a good rationale as to why you choose one versus the other. In this situation, it's a very binary, early versus late, but in most situations that you're encounter, there won't be a binary yes or no, black or white. There'll be several shades of gray. It's going to be up to you as administrators to process this information and come up with an opinion. If you shoot out of the gate and say, I'm an early adopter because you've got an iPhone 10 or you've got whatever latest technology because that's you, that's not going to sway me, who's almost 50 years old, to think the way you do. So where am I coming from? Where are other people coming from? What are the other points of view? And how can you address those and understand those so that you can then persuade me to perhaps become or line up more with your way of thinking? And that's really going to be that power of persuasion, as I mentioned earlier, along with this critical thinking, is really going to help you be a successful influencer as an administrator. About that discussion point, by the way, there were about 70 to 30, 70% of you, 30% of you. 70% of you wanted to be early adopters and articulated why, and then about 30% of you said that it would be better to be a late adopter. So it's really good, but it also illustrates that not everybody thinks the same way. If everybody, we can all agree that we want quality care, but this isn't the issue. Everybody wants quality care. It's these issues that impact financial processes, people's work experiences that ultimately will touch patient outcomes. Again, if you have any questions about the upcoming assignments, go ahead and feel free to ask. I may or may not answer them because, as I said, you may be confronted with somebody who asks a question or presents you with a scenario and asks you to come up with something, but they give you very little direction. If I'm a doctor asking about, what is your thoughts around EMR and should we implement this, I may not have much more to give you. So I'm looking for you to provide to fill in the blanks. So it may feel like, well, I can't miss anything. And that's not the case. What you need to do in every single assignment is consider the different viewpoints, come up with a point that you agree with, and a rationale as to why. Those are really the important things. Oh, I'm sure I'm missing a few things, but overall I'm very pleased with the start of the course. This week is also kind of a heavy week, and I apologize about that, but I do promise you that as we go through this, it will lighten up considerably as far as the amount of material that you're reading, but we will be focusing a little bit more on the critical thinking and on the position papers and the discussions. Keep in mind that, the grading in the early part of the quarter or the semester, pardon me about that. That's how old I am, as I was on a quarter system. Grading in the earlier part of the semester with the first few assignments is much more generous than it is as we go later on, because I'm expecting more from you. I also have a little bit more to go off of, having seen some of your writing styles as you go through, and anybody that's received some feedback from me probably already knows that I'm trying to get to know each and every one of you as well as I possibly can in the format that we have. Thank you again. I hope you have a wonderful evening, and please, please, please do not wait until the last minute. I cannot provide the most effective feedback when you're waiting to the last minute. It's terrible waiting up on a Tuesday night for people to get finished so I can grade so that they can have an idea of where they stand in the class, especially the first couple weeks. Anything else, please feel free to reach out to me. I'm super available and have no problems at all, usually getting back within an hour or so. But sometimes, within 6 hours to 12 hours. But please reach out to me, and I wish you luck this coming week.